If you're having pain in the side of your hip, kind of in this area, and you might have trouble lying on your side, maybe sleeping's uncomfortable, maybe walking around's uncomfortable, squatting down's uncomfortable, maybe just hurts all the time, you probably wonder what's causing it and how do you get rid of that? Well, I'm Dr. Stephanie and I'm a physical therapist. I've worked as an outpatient orthopedic PT for over 13 years now, and I've seen a lot of people with pain in this area. They used to call it bursitis, and you may have heard it called that. You may have been told you have bursitis. There is a bursa, which is a fluid-filled sac right by that greater trochanter, kind of that bony area on the side of your hip that's part of your femur, this big bone here. But they have found that usually, even though there's a bursa there and it may be irritated, that's usually not what's causing the pain in that area. A lot of times it's just weakness in your hip flexors or your glutes, those hip abductors that move your hip out to the side. So weakness in that area or lack of mobility in your hip, in your spine, that can just put excess stress in that area. Or maybe it's just from overuse as well. But by strengthening those muscles, working on a little bit of mobility, you can actually get rid of that pain and get back to doing all of your favorite things without pain at all. So we're going to go through some exercises that will help you get rid of that pain and get back to doing everything you want to do. So all you need today is this loop resistance band, any type of loop band. You actually can do most of these exercises with no band, but I'm going to show them with the band. That's just gives you a little more challenge, kind of works on your muscles a little bit more. So for the first exercise, you want to lie on your side, and you want to make sure your whole body's in line. So you don't want your legs to be too far forward or too far back. They can be back is better than forward because then you make sure you're using the right muscles. So for this exercise, what you want to do is lift your legs straight up and make sure your toes are pointed straight out. You don't want them to point up towards the ceiling at all. So lift up, and then you want to bring your leg forward and then backwards, and then back down to the middle. So lift up, bring it forwards, backwards, and back down to the middle. And you want to try to do this 8 to 10 times. And then once you do this on one leg, then you can switch to the other. Even if you're only having pain on one side, I would still recommend doing both sides so you can really build up that strength. So 8 to 10 times, and then you can actually repeat that another time and even 3 times if you want to. So 3 sets of 8 to 10, just nice and slow. This is really working on the glutes, especially that gluteus medius here, and that's the muscle that brings your leg up to the side. The stronger that is, the less pain you usually have in your hip and your knee and even your foot and ankle. So I start with that one. Then we're going to move this band up to around our knees. And this next one may be a little more challenging, but I'll show you 2 ways you can do it, or actually 3, because there's one way you can do it without the band. So for this one, you want to get on your elbow, knees bent like this. We're going to come up into a side plank and then do a clamshell in the side plank. So just lift that knee, keep those feet together, just lifting that knee up and down like that. You can also do this with no band. You can also just hold this position. This is another good way to do it. And then if you're not ready for that, you can just start with the clamshells here, just lifting your knee up. Just when you do this, make sure you're not rotating back. You don't want your hips to move. You want just your knee to lift up and back down. For whichever one of those you do, try doing 2 to 3 sets of 8 to 10, and then flip to the other side and do the same thing. Okay, we're going to leave this band here, come up onto our hands and knees. We're going to do 2 exercises in this position. The first one is called a fire hydrant, and that's where you're just going to bring your leg out to the side here and then back down. This is a great one for gluteus medius strength and really all the glutes. It's actually working both sides when you're lifting one side, because you have to stabilize with the other side. So you're just lifting to the side and back down, lifting, back down. You want to do, again, 8 to 10 reps, and then repeat On the other side, 8 to 10 reps. And then you want to do 2 to 3 sets of that. Then in this position, we're going to go and do a hip extension. So just straight back like that, trying to get that leg up to parallel to the floor and back down, leg up and back down. 2 to 3 sets of 8 to 10. I like to do, if I'm doing 3 sets of 10, do 10, and then switch to the other side and do 10, and then alternate back and forth. And you can do 2 or 3 sets. This is kind of a lot since you're doing both sides, so you can start out with 2 sets of 10 and then add that third set when you're ready. Then in this position, I'm going to leave the band on, but for this one, you don't have to leave that band on. So we're going to do a bear plank. So hands and knees. From here, we're just going to lift our knees off the ground and just hold this position. And you can hold 5 seconds to start and then get up to 15 to 20 seconds. But make sure you work up to that. So if it's difficult at first, just try to hold 5 to 10 seconds and then gradually increase the time. But just going to lift, keeping your back flat. This band adds just a little extra because there's a little more resistance, but you can do it without the band too. So you want to just do that about 10 times, holding anywhere from 5 to 20 seconds. And then relax in between, and then just repeat that 10 times. You can also, well, let me take the band off for this one. For the last exercise, this is a definitely more challenging one, but this is a good way to go if you've gone through the rest of them. So this one, I'm going to come up in a bear plank and then stick your leg out and back, and the other leg out and then back, just to make it a little more challenging. And this one, I would suggest doing 20 or 30 seconds and then repeating that 2 or 3 times. So all of those exercises are going to build strength in your hips and take that stress off of that outside of your hip area, because just excess stress is placed there when the muscles aren't strong enough to kind of support you. So when you're walking, if those muscles aren't strong, your hips can kind of dip back and forth. So if you've ever noticed that, like you don't feel like you're walking evenly, your hips are kind of swaying. That's most likely because of hip weakness, glute weakness. So if you can strengthen that, that can actually help prevent stress in that area and get rid of that pain.